This recording will go over IV therapy. IV therapy involves administering fluids via an IV catheter to administer medications, supplement fluid intake, or give fluid replacement, electrolytes, or also give nutrients. Nurses or pharmacists mix IV medication in a large volume of fluid to give as continuous IV infusions or intermittently in small amounts of fluid. Nurses also give medications as an IV bolus, giving the medication in a small amount of solution, concentrated or diluted, and injecting it over a short time, 1 to 2 minutes or longer, depending on the medication. Advantages of IV therapy include it has rapid effects. So if I'm having pain and I'm given an oral pain medication, it's going to take longer for my pain to be relieved. If I'm having pain and I get an IV push of some sort of pain medication or narcotic, it's going to have a rapid effect to relieve my pain. Other advantages include precise amounts of the drug is given. There's less discomfort after initial insertion of the IV. We can have constant therapeutic blood levels, less irritation to subcutaneous or muscle tissues. It permits the use of large volumes of fluid for medications that are poorly soluble and need larger amounts of fluid to dissolve. It also permits the use of medications that contain irritant properties, such as chemotherapy. Disadvantages include circulatory fluid overload if the infusion is too large or too rapid, so there'd be too much fluid in the system. Disadvantages also include immediate absorption, which leaves little time to correct any errors if there was a med error. IV fluid administration can irritate the lining of the vein. And finally, failure to maintain surgical asepsis can lead to local and systemic infection. So there's different types of IV. There's peripheral or central IVs, and there's also midline IVs. We'll first start with peripheral IVs. So when you talk about the different types of IV, the term or the descriptor, such as peripheral, talks about where the IV ends. So a peripheral IV or catheter ends in the periphery or in the limbs of the patient. So this IV catheter doesn't extend that far, right? So I have fluids, medication that I'd push that would run through the tube, run through the catheter, and then go through the patient's vein, right? The catheter ends right there. With a central catheter, again, the term central tells me where that catheter is going to end. It's going to end in the center. It actually ends right above the right atrium. Types of central venous catheters include jugular IVs, subclavian IVs, and then also PICC lines. So PICCs are inserted peripherally, but the catheter travels all the way to the center of the body right above the right atrium. So of all these, whether the insertion site's at the jugular, subclavian, or PICC, every one of these catheters is long enough to travel and end right above the right atrium. So this first picture is a picture of a PICC, which is a central IV, right? The catheter goes all the way up to right at the entrance of the right atrium. Just to throw it in there so you're familiar, there's also catheters called midlines. So the insertion site is very similar to a PICC. You have to be able to look at charting and labeling to know that it's a midline. The catheter itself stops short, right? So you have a peripheral, that's just a small catheter in the periphery or in the limb. A central, which goes right up to the right atrium regardless of where the insertion site is. And then a midline, which stops in the middle, stops in between, a midline catheter. Guidelines for safe IV medication administration include using an infusion pump to administer medications that can cause serious adverse reactions. Never administer them by IV bolus. Double check the dose prescribed, the dilution or amount of fluid, and the rate at which to give the medication. Add medications to a new IV fluid container, not to an IV container that is already hanging. Never add IV medications through tubing that is infusing blood, blood products, or parenteral nutrition solutions. Verify the compatibility of medications with IV solutions before infusing a medication through tubing that is infusing an IV solution. So in most drug books, or a lot of times in the med room, there'll be a large chart and you're able to pick 2 medications and sort of follow them until they connect and determine whether they're compatible or not. So for any sort of IV medication, you want to check for compatibility. Perform any assessment required prior to administering based on the medication and determine if continuous monitoring is required during administration, such as ECG. Use the IV port closest to the client to administer medications. So with an IV push or bolus, you'd want to use the hub that is closest to the patient. So if I'm your patient, I'm hooked up to IV fluids and it has a long tube coming to my IV site, the tube itself will have some hubs. You'd want to give that push closest to me. Ensure the IV is patent prior to administration. If the client does not have IV fluids infusing or has fluids that are not compatible with the medication, flush the IV access before and following administration. You want to be careful to prevent any needle sticks when starting an IV. I tell the story, I know of a nurse who was trying to access a chest port and was pushing really hard, having problems, and then withdrew it, and the needle had actually curved, so the safety wouldn't go over the needle. And she set it on a bedside table and continued doing whatever she was doing. Another nurse walks in, sees it, grabs it to put it in the sharps, and actually poked herself with it. So it's important that we dispose of our sharps in the proper manner for safety. In regards to specific considerations, older adult clients, clients who are taking anticoagulants, and clients who have fragile veins can have some specific considerations, such as avoiding using tourniquets, but using a blood pressure cuff to help visualize but not over-distend veins. We don't want to slap the extremity to visualize veins. We want to instruct the client to hold their hand below the level of the heart to help distend and thus visualize veins. We want to, this one says avoid using the back of the hand. A lot of times we start with the hand and move up, right? If a patient's going to be having long-term IV therapy, we'd start with the hand and move up because if the site goes bad, there's more options. But it can be painful. Patients will complain about the pain. Also, avoid rigorous friction when cleaning the site. If the patient has edema, we want to apply digital pressure over the selected veins to displace the edema. Apply pressure with an alcohol pad and cannulate the vein quickly. For clients who are obese, you may need to use anatomical landmarks to find veins. In regards to preventing IV infections, we want to make sure we follow all the policies that are in place at your facility to prevent infection. So, right, we clean the skin prior to starting the IV. We would change tubing every so often, whatever your policy is, or 72 hours, or whatever the policy may be at your facility. With PICC lines, that's a really, this is a sterile procedure, and it's very serious because that catheter, again, is going directly right into the heart. So if we have any sort of infection on that catheter that travels along, it's going to take the infection straight to the heart. So we want to make sure that we're preventing any infections when initiating an IV and then while administering IV fluids. In regards to complication, 2 big terms you need to be familiar with are infiltration and extravasation. So infiltration is when a non-vesicant solution or a non-irritating solution leaks outside of the vein. Findings associated with infiltration include pallor, local swelling at the site, coolness or decreased skin temperature around the site, a damp dressing, and slow infusion. Treatment, the first thing we do is stop the infusion. So anytime there's something wrong or you question something may be wrong when your patient's getting an IV, step 1, stop the infusion. You can also remove the catheter. If the fluid is infiltrating, it means that IV site is done. You're going to have to pull the catheter and restart. Elevate the extremity. Encourage active range of motion. Apply a cold or warm compress depending on the type of solution that infiltrated. And check with the provider to determine whether the client still needs IV therapy. If so, restart the infusion proximal to the site, right? So you're moving up, or in another extremity. Maybe you have a patient who's on some fluids, but it's going to be discharged in 2 hours. There's going to be no sense restarting that IV for another 2 hours of fluid. The provider is going to say, yeah, just leave it be and they'll be able to be discharged without getting another additional poke. To help prevent infiltration, carefully select the site and catheter. Make sure the catheter is secured adequately. Inspect IV infusion site frequently for any findings of infiltration. So every time you're doing your hourly rounds on your patient, you should be eyeballing that IV site and looking for signs of infiltration. Another complication is extravasation. Extravasation is just infiltration of a vesicant or tissue damaging medication. So it's leakage of whatever's going through the catheter, but with extravasation, it's a really irritating vesicant that can cause damage. Findings would include pain, burning, redness, and swelling. Step 1, if you note this, is to stop the infusion. Notify the provider. Follow the facility's protocol, which can include withdrawing the vesicant solution from the IV access and infusing an antidote through the catheter before removal. So you need to know if it's something that has an antidote, you want to leave the catheter in place so you can deliver the antidote. Further treatment is the same as for IV infiltration. To prevent it, closely monitor the IV site and dressing and always use an infusion pump. Other complications of IV administration are catheter embolus, so when a piece of the catheter breaks off, phlebitis or thrombophlebitis or irritations of those veins, cellulitis, irritation of the skin, and fluid overload.